We've had two mass shootings in less than a week, and for many Americans, the tragedies are hard to process. Today, I spoke with Dr. Jill Gover, the behavioral health manager from DAP Health, on ways for us to cope. Dr. Gover, good to see you again. Thanks for joining us.
Oh, absolutely. Pleasure to be here.
Well, we've had two mass shootings in our nation in just less than a week, with multiple people dead. Understandably, this is very hard to comprehend for a lot of people. So first, let's start on generally what tends to be our reaction when seeing and hearing about this type of news.
Well, of course, it's extremely distressing and it's very traumatic, and it brings a host of emotions: grief, anger, fear, tremendous sadness, numbness, just all of the emotions that people experience when they experience a tragedy and something really traumatic.
And obviously, people react in different ways and process this type of information in their own sort of individual style. But what are some things that people can do to help process all of this that's happening? And are there tips that you can share with our viewers?
Absolutely. There's a few tricks I have. Um, First off, it's important to talk about it. Ask for support from people you care about who will listen to you. It often helps to speak with people, especially those who had a shared experience, so you don't feel so alone. Right? This is very, very traumatic, and talking about it really helps to process the feelings. I think it's also important to strive for balance. When a tragedy occurs, it's easy to become overwhelmed and have a negative or pessimistic outlook. So balance that viewpoint by reminding yourself of all the people and events who are really positive in your life. Striving for balance empowers you, um, and gives you a healthier perspective about yourself and the world around you. The other thing is to honor your feelings. There'll be a host of feelings. Um, as we said, it's everyone responds differently. So just allow yourself to feel those feelings. And you may feel a little out of balance and out of sorts, but that's also how you process through the feelings. And take care of yourself. Engage in those self-care activities that will keep you healthy. Eat well, get your sleep, avoid alcohol and drugs because they can actually exacerbate the emotional intensity. So reestablish those really healthy routines of eating well, sleeping well, getting physical exercise. It's really important. And sometimes it can be very, very helpful to do something to help others. Like if you are able to locate resources in the community, or ways that you can help the people who have been directly impacted by these tragedies, we always feel better about ourselves when we're able to help others.
What about people who are concerned about going into public places like grocery stores or even going to a spa, which obviously these were locations where these shootings happened? What can people do to sort of overcome that fear of becoming victims?
Well, I think that we have to, when we have that kind of anxiety, we have to do exposure therapy, which is exposing ourselves to the feared stimulus and reminding ourselves that the probability is very low, that this will happen. And of course, we take a risk every time we step outside. We could get hit by a car tomorrow, right? So we take reasonable risk, right? If we have reason to think that a particular place is unsafe, then maybe we don't go there. But for the most part, random shootings like this, it's impossible to predict what will happen. And so we have to go on and live our lives as if we'll be safe.
Are you also concerned, Dr. Gover, since we keep hearing more of these types of stories, not to mention the fact that we just dealt with the pandemic, that people are sort of becoming numb and desensitized to a lot of what's happening in the world?
Well, yes, and that is a response to trauma. That's one of the emotional responses when we are faced with something that is outside of our typical human experience. It can become numbing. This is what happens with PTSD symptoms for soldiers, for example, of just becoming kind of going in shock and being numbed by what's happening around us because it's so horrific. And I think we have to process those feelings so that we don't remain numb, because we need to be able to feel those feelings that make us human.
Some important advice. Thank you so much, Dr. Gover. It's always great to see you. We appreciate your time.
Thank you.